Hey everybody, this is Dr. Vince from FTR in Joliet, and today I have Amanda with me. She's a PTA student. Today we're going to cover a test that you may see performed in the clinic if you come in with signs and symptoms of dizziness or unsteadiness. This test is called the DVAT, otherwise known as the Dynamic Visual Acuity Test. What you'll do is you'll be seated in front of an eye chart, just like that, like if you were to go to the eye doctor. And we'd have the patient read the lowest line possible. So what's the lowest line you can read?
P-E-Z-O-L-C-F-T-D.
So she can read the lowest line, and I can read the lowest line with my glasses on. Without my glasses, not even close. So what we're going to do during this test is I'm going to be moving her head left and right. You've heard it before in previous videos that I've done, but it's going to be done at a speed of 120 beats per minute, or 2 beats per second. So again, there's a clock right there, so if I were to do this at 1 beat per second, it would look like this. Okay, this is kind of slow, and so we're going to beat that up to 2 beats per second. If your therapist is unfamiliar with how to get to 2 beats per second, your phone, the therapist's phone, can have a metronome in it if they just Google metronome. If you're at home and you're unsure, always do this test seated, obviously. And if you have an eye chart, it's kind of weird, but cool. You're going to want to do this test seated with a metronome set to 120 beats per minute. Again, ideally this test is performed in the office of a physical therapist or a physician. And so what we're going to do is we're going to go 2 beats per second. It's going to sound like this. And so I have that beat in my head, and we're just going to go left, right, left, right. Now what's the lowest line you can read backwards?
T-D-F-C-L-O-Z-E-P.
Okay, so she read the same line. 3 lines or more lost means that you have to go up more than 3 lines. That's considered a positive test. And this test is very good for classifying patients who have bilateral vestibular dysfunctions. And it's not quite as good, but it's still okay with classifying patients who have a unilateral vestibular dysfunction. Again, thanks for watching. If you have any questions, contact us at FTR in Joliet. Again, these tests should be done in the presence of a physical therapist or a physician. Thanks for watching.